We interviewed 3 informal caregivers with a unique background about their experience with Mantle. They will give us an insight into their lives before and after using the service.
I'm Evelyn, and I am an informal caregiver for my husband, who has cancer.
Soy David, soy cuidador informal de mi madre que tiene esclerosis múltiple.
Ik ben Daniel en ik ben een mantelzorger voor mijn vrouw die moeilijk te been is.
1 out of 3 people provide informal care.
My mind wanted to keep going and keep caring, but my body was just exhausted.
1 out of 3 informal caregivers spend at least 15 hours a week on specific caregiving tasks.
Llevo siendo cuidador desde mi niñez, así que no conozco otra vida.
1 out of 5 children between the ages of 11 and 18 are informal caregivers.
Op een gegeven moment kwam ik het huis gewoon niet meer uit. Ik zag niemand meer.
Half of informal caregivers report feeling lonely and isolated.
I was already active within Mantle as a helper before I became a caregiver myself.
El médico me enseñó unos panfletos en la sala de espera y es gracias a ellos que conozco Mantle.
Ik heb Mantel leren kennen via het gemeenteblad.
Mantle is an easy-to-use service that allows informal caregivers to request assistance with everyday tasks and errands to ease the load of their caregiving responsibilities. After registration, the informal caregiver can choose between visiting the local care hub or receiving a visit from one of our service employees.
So the hub is a place where people can come with their questions and concerns. We try to make it a social space between patients, caretakers and helpers. We have a number of hubs in a couple of cities around the country. We also organize workshops that are funded by the government, where people can learn about basic tasks like gardening, basic health care. And we also organize thank you events. This is to recognize the hard work people have done.
We were able to follow along with David, who is going to one of the care hubs close to his home for the first time. Each new member is welcomed at the hub for an intake conversation. At the first visit, the coordinator takes their time to walk the new member through the system. They discuss the caretaker's experience, what is going well, what is difficult, and what type of help would make a difference. Following the intake conversation, the coordinator helps them get started on the platform, how to request support, how to connect with people in the community, and how the keychain works.
We also make use of a small physical device. Everybody has one. The caretakers, the nurses and helpers. When 2 devices touch, we make a link on our platform. This registers that a task has been done and transfers the needed payments.
After his visit to the care hub, David is ready to post his first request. He is looking for somebody who can come by to help with the cleaning while he takes his mother to the hospital. Very soon he sees that Aidan has responded to the request. Through the platform, David and Aidan are brought into contact with each other to make further arrangements.
Mantle is a platform that connects everyday people to informal carers who need a little hand in their day-to-day life. Informal caregivers post a task on the platform and then I can choose which one I want to do and get paid for. I really like the service because it's varied, you can do a lot of different tasks and it's much more fun than doing a regular student job.
After Aidan has accepted David's request, they meet up. The platform displays requests to helpers living in the neighbourhood of the caretaker. This creates a connected community in which neighbours can get to know each other better. When the requested task is done, the helper and informal caregiver need to touch their keychains together as an embodiment of a handshake. Through this, the system knows that the task has been completed. The helper will receive their part of the payment immediately, and the other part will go into the insurance fund.
For me, becoming a helper was never really about money in the moment. It was more about the long-term security it gave us. In this service, every helper gets paid an hourly wage for the tasks they complete. A small part of that wage automatically goes into your insurance account. Kind of like a personal savings pot the system keeps safe for you. I can't even explain how grateful I am that we had those savings ready. It made asking for help so much easier, both emotionally and financially.
Gracias al apoyo que tengo por parte de Mantel, por fin tengo un poco de espacio para mí mismo otra vez. He conocido a gente que realmente disfruto estar con ellos y tengo tiempo para ir a hacer ciclismo una vez a la semana y se siente genial tener esa parte de mi vida otra vez.
Sinds ik bij Mantel ben, sta ik er niet meer alleen voor en kom ik nu af en toe eens terug buiten.
Mantle rebuilds what society has forgotten, taking care of each other. When a caregiver struggles in places that use Mantle, a whole community steps forward to carry the weight together. And one day, when one of us needs support, that same help will find its way back to us.